Mississippi has nearly $206 million coming in federal funding this year. All of it is intended to transform the state's rural health quality and access. 3 News Side's Courtney Ann Jackson has the latest status check on that program.
For many rural Mississippians, getting care can mean a long drive, a crowded ER, or waiting for an appointment with a specialist in a larger city. Now, the state is preparing to spend millions in federal funding to help close those gaps.
Success is not measured by the grants awarded. It's measured by the results that rural Mississippians see.
More than 700 applications came in during the first round of grants, seeking more than $676 million, far exceeding the roughly $82 million available.
It's a quick timeline. We are moving towards the October deadline to have all these funds obligated.
That process has also drawn scrutiny. Lawmakers considered additional oversight measures for the program, while Reeves has argued federal requirements and the state's existing review structure already provide accountability.
Every applicant will be evaluated using the same standards. Every application will go through the same review process.
For you, that funding could mean more services at your local hospital, expanded telehealth access, or less time traveling for care. One upcoming grant program focuses on psychiatric emergency services, creating a specialized alternative to an emergency room or jail for someone in a mental health crisis.
Is going to fill a major gap, and it is going to help our rural areas that don't have these services available.
The first awards are expected by the end of the month.
We see just the opportunity of Mississippians to live a longer, healthier life.
The long-term measure of success, whether rural Mississippians can get care closer to home when they need it. Courtney Ann Jackson, 3 on Your Side.